Everyone. It's my pleasure to be with you here tonight to give you an overview of the West Dallas Health Department. So we will start tonight's presentation with just a high-level overview of our mission statement. So the West Dallas Health Department will provide community leadership to protect and promote the health of all people of West Dallas. It's also noted that we also serve as the health department for the village of West Milwaukee. And then as far as our vision statement, through services based on prevention, education, and continuity of care, we create an environment dedicated to optimizing the health of West Dallas citizens. So this is the core basic framework of the health department. Before we launch into the detailed presentation on the services and the programs that we provide, let's just take a couple minutes and I want to show you a video that was produced a few years ago by a national organization that really does, I think, a solid job of portraying visually what a comprehensive health department does. So I think it helps to kind of lay the foundation of what we are doing as far as any boots on the ground services and programs we provide. So with that, let me launch the video and hopefully it worked, and we will come back when it's done. Okay, we will move on. So as we focus on the West Dallas Health Department, the slide in front of you is essentially just a portrayal of our organizational structure. And so you can see that we are made up of at least 5 divisions, one being administration, another being community environmental health services, Another being the WIC program, or otherwise known as the Women, Infants, and Children program. We also have a team looking at policy and practice. And then we also have involvement and oversight of the Senior Center. As we jump into each of these, we'll focus more so on the programs and services that each of these provide. So as we think about administration, a primary function of what happens in administration is actually the production of birth and death certificates for residents, as well as citizens throughout this area. West Allis is one of two actual city vital records offices in the state. So we are unique in many respects. Individuals can order birth certificates online at cost, and we will produce those for those folks who are interested. And they can come on site and pick stuff up. If anybody's interested, all the information is available on our website. As we transition to community health services, so again, kind of recognizing that it's a community and environmental health, we'll focus a little bit on community health services specifically. So this particular division focuses on the provision of clinical services, referral and resources, home health visits and consultations, and then communicable disease control. When we focus on clinical services, what we're talking primarily about are vaccinations. So we're looking at flu vaccine as being really a predominant vaccine that the health department is pushing out to residents on an annual basis. Other vaccines, of course, are like varicella, so for chickenpox and hep, Tdap, the series of vaccines that kids typically need. And of course, most recently, now with the availability of the COVID-19 vaccine, we are making that available. So as you can imagine, we are operating as much as we can, full steam ahead, making vaccines available to those who are eligible. Other clinical services that are provided, we'll focus on tuberculosis. So if we have an active TB case in the jurisdiction, our nurses will actually work with that client to actually counsel and actually do home visits to make sure that if there's a need to, that client will actually be taking their meds. We also provide just basic blood pressure screening. So folks, when we had an open door before COVID situation, folks could come in and just have their blood pressure taken. We also do just basic blood level testing. So as part of our WIC program that we'll touch on in a little bit, but then also tying together nicely with our nursing staff and then our environmental staff, we actually pull a little bit of blood from kids who are in the WIC scenario, and we'll actually analyze that. And then if we need to, we will follow up with those parents and guardians and homeowners if it's a rental situation. Moving on, referral and resources. So staff within a clinical environment is available to provide residents with information, consultation, and community referral for really any health-related concerns and questions that they might have. Home health visits and consultations. This is really about the provision of home health visits for infants, children, adults, and the elderly, whereby we will provide support and assess the individual situation to provide resources and help link people to qualifying services. So again, a nice service that actually gets staff out of the office and into people's home when there's a need to do so. And then of course, communicable disease control. a primary function and role of your local health department, including the West Allis Health Department, is communicable disease control. So largely what that entails is follow up with individuals and as needed organizations on all reportable communicable diseases, including COVID-19, to provide information, guidance, and counseling. Just to offer a little bit of insight with regard to just the sheer volume of COVID cases that we've had. We have really, in effect, since the beginning of, well, I don't want to say 2020, but since March when we had our first case of 2020, we have actually managed over 7,000 positive COVID cases. So this is in here really just to kind of show you the types of metrics that we will look at routinely to help us monitor the situation. And then in doing so, that just helps us to prepare and then effectively respond to activities. So we can look at trends and data and then essentially use this information to gauge how we're going to respond. So these are just, a few examples of the types of data sets that we have when we look at positivity rates, so on and so forth. Another set of data that we look at is otherwise called burden data. And so this is a snapshot of a type of report that we have available to us. And this is essentially just a comparative review of West Allis to Milwaukee County. And when you look at the basic graph and the colors scheme to it, you can see that it ranges anywhere from low to critically high. And the unfortunate reality is that back in November of 2020, we had some significant spikes in cases. And so as you can see, that's portrayed on this graph. Fortunately, you can see that the downward trend has been happening really since then. And, we knock on wood for that. Because, with a novel unknown virus like this, there's really no way we can predict its behavior. Moving on, that's a basic overview of community health services, and now we're going to touch on environmental health services. So we have a team environmentalists who are largely responsible for licensing of and inspection of restaurants and bars in the jurisdiction of West Allis, as well as the village of West Milwaukee. So here's just a basic listing of the types of services and programs that the environmentalists have responsibility for. It's a proactive situation, but as well as a reactive situation. So we have scheduled times to go visit and do inspections. Otherwise, there are random inspections. And then two, as you can see towards the bottom there, we are also responsive to nuisance complaints, animal bites, rodent insect infestations, and then as well lead-based paint hazards. So if we talk a little bit about lead-based paint hazards, just to kind of share with you the interplay of how WIC, when we were talking earlier about pulling a little bit of blood from a WIC kiddo, that is actually then analyzed, and we can actually then very quickly determine if this child is at increased risk or blood lead contaminated. If that appears to be the case, then we activate the nursing team, and then in many respects the environmentalists, who will potentially do some form of follow-up and home inspection if there's an absolute need to. Family health services. Largely, again, as the name and title implies, the focus of these services and programs are oriented to families. So prenatal care coordination, or otherwise known as PNCC, is really a program that is geared towards high risk women, pregnant women who are in need of resources, and then as well as guidance and support from nursing staff. And so this is again a scenario where we identify at-risk clients, or they are or we are notified of them, and then we can go into that person's home and actually work with them even at the earliest stages of their pregnancy to hopefully assure that they've got a safe and healthy delivery. Child care coordination. So parents and children can meet with a nurse to discuss parenting and connect with community resources. And then, of course, as part of the family health services, a major aspect or component of that function is the WIC program. For those not familiar, WIC is a supplemental food program for pregnant women, breastfeeding and non-breastfeeding mothers, as well as infants, and then children up to the age of 5 can get services. A very well respected program, and then one in which we provide services here for not just our residents, but as well for residents in other areas as well. And if anybody has an interest in learning more about the WIC program, feel free to call 302-8642, and someone would love to talk with you and give you even more education on what the WIC program does. So as we move on, we have a policy and practice unit, which historically has been otherwise known as the interdisciplinary unit. And but really the focus of this team is to, as the name implies, focus on opportunities to create policy and or shore up policy that has a public health lens to it, but then also looking at ways that policy can also drive the practice and the things that we do on a day-to-day basis. Ways that we do this in terms of policy development and practice development and implementation is we go through a process that is really heavily focused on community engagement. And by statute, state statute, all health departments in Wisconsin have to go through every 5 years a community health assessment process. And so that is identified here as the CHA, endearingly. And really what is involved during the CHA process is a lot of data collection from a number of different sources that range from individuals who are a part of this information gathering process to secondary data sources. So we use population health data sources to identify kind of current trends in our health situation, health status. That data then informs a community health improvement plan and the development of that plan. So we organize stakeholders, partners, community members to essentially come together a number of times and over a course of time to work with the data that we've collected to really identify what are the top priorities, the top health priorities that we should be focusing on. And ideally, this is not just a situation where it's just the health department. A best practice, really then does speak to a scenario where, again, collectively, health is working with other city departments who also have a health focus, as well as school and businesses, recognizing that pretty much everything people do, to some degree has a health aspect or health focus to it. And so, of course, a business would stand to benefit by having healthy employees. Well, let's talk a little bit with that business about what that might look like. So point being is we pull these folks together, whether they're individuals and or organizations, and we come together on identifying those priorities, but then we also work to develop strategies, again, best practice or promising practice strategies, as well as actionable items or activities. Another aspect of the policy and practice team is health education and health promotion. So that's really when you see various events that we have, and that could be the mask distribution events that we've had periodically over the past year. It's also a Living Well with Chronic Conditions program and infant massage services that have been offered and classes that have been offered through our department. And then certainly a big aspect of what we do in public health and the health department here does is inform and communicate. And we do that primarily through using websites, social media, and presenting like this in any sort of forum that we have an opportunity to share our story. And then two, we also are unique in that we have really an oral health program. We do have a hygienist on staff who works with the schools to identify kids who are at risk, but then also do some screening of those kids. If you're interested in learning more about any of these programs in particular, you're encouraged to visit our website and or just kind of track us on social media as well. Please recognize though that, in the midst of a pandemic, this past year has been pretty shy on our ability to get out and interact with people and provide classes. And so we're going to try and do our best to get back to some normalcy this year. Not for sure that we're going to be able to get out into the community as much as we would hope, but we'll do our best to make ourselves available. And then really a core function of the policy practice unit as well as quality improvement and performance management. And so the QI/PM aspect, and really critical to what we do on a day-to-day basis. Really the purpose there is where we strive to assure that programs and services are provided in an efficient and effective manner. In terms of information and communication, I'm sharing with you just 3 examples of a report that we push out on a weekly basis. So you may have seen these on the city website. You may have seen these on the city Facebook page, or the health department Facebook page, or the health department website. But these are chock full of information, and we try to make them unique every week. I think they've been largely well received, and we'll keep continuing to develop these. And then certainly, last but not least, we have involvement with the West Allis Senior Center, and the Senior Center is available to provide support to those adults, who are 55 and older. Really a wonderful program department that the city has available to us, and that it allows for access to various activities, events, and services. Members have the ability to tap into a fitness center. And then 2, as far as getting meals to the seniors who are struggling to feed themselves, we also are our partner with the Milwaukee County Department of Aging and their senior dining program. And then there's the website at the bottom if you want to learn more about the Senior Center. And then it goes without saying that as a public health department, again, in the context of what we do, really from the perspective of being effective, with the involvement of others, whether those are organizations or individuals, You're all certainly invited to join us in any way, shape, or form that you are interested. If you have a particular interest in healthy lifestyles or mental health challenges and concerns and/or alcohol and drug use, those are currently the priorities that the health department have on its plate right now. However, as we move into a next phase of our CHIP process, as we talked about earlier, those priorities may be modified. But for now, right now, we're looking at those three that are in front of us. So again, if you have any interest, please let us know. And that's it for the end of the presentation and a little bit of information as far as our location and contact information, and as well as an invitation to join us on our social media. Please do so. And with that, I will pause.
Thank you, Bob. And I'm going to unmute Ashley as we turn it over to a few questions that we've had. Our guests were invited to submit questions in advance, and we received 2 questions relating to the COVID-19 vaccine. I wondered if you could speak to where we are in the vaccine phases of the rollout and where people can go if they're interested in more information.
Certainly. Yeah, so the questions we received, being an essential worker and having a spouse that has COPD, how can we receive the COVID vaccine? It's important to know that the health department follows Wisconsin Department of Health Service guidelines for those who are currently eligible to receive the COVID vaccine. You can find out full information about Wisconsin vaccine rollout here. So if you go to COVID-19 and you access the Wisconsin Department of Health Services website, there's a lot of information there specifically on COVID-19 and who the eligible populations are at this point. Currently, eligible individuals are those in phase 1A to include healthcare providers, long-term care employees, and residents, in those in phase B to include police, firefighters, and those 65 years and older. So if you don't fall within one of these groups, other eligible individuals will become eligible as more COVID-19 vaccine supply becomes available. You are encouraged to check out the West Allis websites, to include the city website and the health department website, and then the associated social media accounts like Facebook. As well, you're encouraged to contact your healthcare provider and Walgreens pharmacy, as they have recently come on board as a federal retail pharmacy program partner. So it's our understanding that the Walgreens locations here in our jurisdiction are making themselves available to serve as a vaccinator. However, it's also our understanding that they too are getting very limited supply. So you've got a number of potential resources either through Walgreens, your healthcare provider system, and again, you can certainly contact the health department. There's also another question with regard to distribution of COVID vaccine for those that are 65 and older. Those who are 65 and older are currently eligible, and we are vaccinating those individuals. However, due to the short supply of the vaccine, individuals have been expressing interest in being vaccinated and those interested in being vaccinated can actually complete a form online if any folks are ready, with a pen and pencil, or I don't know, Jenny, if you've got a way to pop this up on the screen, but at westalliswi.gov/COVID vaccine. So again, westalliswi.gov/COVID vaccine.
Thanks, Bob. And for everyone, I did drop that link right in our chat if you need to click through it right away.
Okay.
Another question we had, Bob, and you touched on this briefly, was volunteering with the health department. Are there any opportunities to do so?
It's a wonderful ask. It really is. And what we're encouraging folks to do right now is check out another website, and it is https colon, and it's Weaver, so 2 forward slashes and then Weaver, WEAVRWI, Weaver, WI.org. And it can be a little cumbersome, but at the same time, that particular platform allows us to essentially identify volunteers who are readily available and have certain qualifications and competencies that we might be looking for.
Thank you. I dropped that link in the chat as well. And if anyone is interested in other volunteer opportunities in West Allis, you can visit www.westalliswi.gov/volunteer, and other volunteer opportunities in the city are listed there. Great. We received another question in advance. And the long and short of the question, and I'll cut to, is why should we trust experts on COVID-19? There's been so much information circling around in the past year. I think it's been hard for a lot of folks to know where the correct information is coming from. So could you speak a bit to who the experts are and why we should trust them?
Certainly. Yeah, so the specific question really kind of speaks to the strategies that we use, and really it needs to be recognized that we're dealing with a pandemic, and it really is a novel virus. So really what that means is we have no way of predicting its behavior, for one, and then secondarily two, we're trying to deal with a virus that's highly transmissible without a pharmaceutical intervention up until recently. So when we're faced with that situation, really, we have in public health, we have a toolbox that we sometimes go to, and the toolbox is really what we call non-pharmaceutical interventions. And inclusive of non-pharmaceutical interventions are things like wearing masks, also social distancing or physical distancing, washing hands. If you're not feeling well, stay home. These are all tried and true practices that together we know work. And it's tough to imagine the numbers we may have been facing if these non-pharmaceutical interventions weren't employed. Things could have been a lot worse.
Thank you. Could you speak a bit, Bob, to how the senior center has responded since COVID hit and how they've changed their operations?
Certainly, yeah, the senior center, especially with regard to the highly at-risk population, has essentially been shut down, throughout the course of this pandemic. However, they have been involved very much in the distribution of stock boxes. So you may have seen the lines of traffic at the Pick and Save. And then two, with regard to the senior dining program, they are able to actually continue to distribute meals to those in need, essentially through a drive-through kind of process. And so it's been a very, very successful effort on their behalf. And it's just an awesome resource to have, especially for the folks at high risk of being exposed to this virus, and not having to introduce themselves to high-risk populations and scenarios. They can just stay in their car and get their food and head home.
Just a reminder to everyone, if you do have questions, we can drop them in the chat. We'll do our best to answer them.
There was another question here, Jenny, with regard to the emergency declaration.
Yes, thank you. I see that one. Please answer that.
Yep. So really, with regard to an emergency declaration, the question was, the Common Council recently extended the state of emergency that gives city leaders specific powers. Does the state of emergency give anybody in the health department any additional powers to enact restrictions or mandates or orders of any kind? So an emergency declaration does not empower health department staff or others to do anything above and beyond what is allowed by state statute. An emergency declaration is intended to make needed resources available to effectively respond to an emergency and get reimbursed for associated expenses. So I just wanted to take a moment to respond to that question.
Thank you. Not seeing new questions in our chat. If anyone in our audience does have any, please drop them in now. And as a reminder, you can certainly visit our website to contact us after this webinar if anything should come to mind. And please watch your email in the coming days. Once again, we'll be sending a survey to get your feedback on tonight's webinar, and stay tuned to our social media and website going forward, as we hope to host these with other departments in the months to come. Yeah, not seeing anything new in our chat that I don't think we've addressed. So I suppose we'll call it a night a bit early. Thank you everyone again for joining us. And once again, we're here. Reach out for us with any questions and watch out for those surveys. We'd love to hear your thoughts on tonight's event. Thank you.
Thank you.
Thank you.
Have a good night.
Thank you.